Welcome to Supplements Demystified. In today's video we will be talking about zinc. We are going to cover why it's important for health and longevity, and how to supplement it safely. Zinc is an essential mineral that regulates the activity of over 300 enzymes and 2,000 transcription factors, as well as being involved in a wide range of biological processes. It performs a variety of functions in the human body, including reproduction, immunological function, and wound healing. While zinc is one of the most abundant trace elements in the human body, it cannot be stored in significant amounts and must be consumed or supplemented on a regular basis. It can be found in a variety of foods, including meat, fish, legumes, nuts, and other dietary sources. The recommended dietary allowance for people over the age of 19 is 11 mg for men, and 8 mg for women. Pregnancy and nursing increase demand, with a daily requirement of about 12 mg. Despite the fact that just 1 to 3% of Americans have symptoms of zinc deficiency, it is estimated that 12% of the population consumes less than half of what is required for optimal health. A lack of zinc is particularly harmful to infants and the elderly. Because of the amount of phytates in their diets, as well as the lower bioavailability of zinc in plant foods, vegans and vegetarians tend to have lower zinc levels. The majority of zinc is lost through pancreatic secretions. We also lose it through shedding skin cells, sweat, urine, semen, hair and menstruation. Zinc is required for transcription factor activity, antioxidant defense, and DNA repair. Zinc deficiency in the diet can result in single and double-strand DNA breaks, as well as oxidative DNA changes, all of which increase the risk of cancer. An American Journal of Clinical Nutrition study looked at the effects of zinc depletion and replenishment on DNA strand breakage, oxidative stress, and antioxidant defenses in healthy males. The researchers put 9 healthy males through 3 dietary cycles. For the first 12 days the men were given 11 mg of zinc daily. Then they had a 6-week zinc depletion followed by a 27-day zinc replenishment period. Before and after each phase, blood samples were obtained to assess DNA damage, oxidative stress and antioxidant levels. The study found that zinc deficiency was linked to increased DNA damage, while increasing zinc levels was protective. A nutrition research study examined the impact of zinc supplementation on DNA integrity. 40 Ethiopian women with suspected low zinc levels received 20 mg daily for 17 days. Blood samples were obtained before and after the study to assess plasma zinc levels and indicators of DNA damage. While plasma zinc levels did not rise at the end of the study, DNA damage markers improved. A healthy immune system necessitates adequate zinc levels. Both zinc deficiency and excess cause the adaptive and innate immune systems to malfunction, increasing the risk of serious infection and allowing the development of a variety of immunological disorders. Zinc deficiency leads to an increase in pro-inflammatory cytokine production, T-cell dysregulation, and a decrease in overall T-cell counts. Excess zinc can reduce T and B cell activity, increase the number of T regulatory cells, and directly activate macrophages. A study published in the journal BMC Public Health looked at the effects of zinc supplementation on the mortality of children under the age of 5 in developing countries. The researchers examined data from 18 randomized controlled trials and discovered that zinc supplementation reduced diarrhea mortality by 13% and pneumonia mortality by 15%. Another study published in the Annals of Nutrition and Metabolism looked at the effect of trace element and vitamin supplementation on death from infection. 81 people over the age of 65 were given various combinations of vitamin C, E, beta-carotene, selenium and zinc over the course of 2 years. The researchers discovered that zinc and selenium, either alone or in combination with other vitamins, reduced the number of infections in the elderly. Zinc is required for both brain development and the maintenance of normal brain function. It is involved in the formation of new neurons as well as the proper communication between them. Zinc deficiency may play a role in neurodegeneration as people age, as well as in those suffering from traumatic brain injury, depression and psychosis. A study published in the Polish Journal of Pharmacology investigated the effects of zinc supplementation on antidepressant therapy. 6 patients with major unipolar depression were treated with tricyclic antidepressants, selective serotonin reuptake inhibitors as well as 25 mg of zinc daily. By the end of the 12-week trial period, patients who received supplemental zinc had significantly lower depression scores than those who didn't. Another study published in the Journal of Affective Disorders looked at the effects of zinc on treatment-resistant depression. 60 patients aged 18 to 55 were divided into 2 groups and given either the antidepressant imipramine or imipramine combined with 25 mg of zinc for 12 weeks. Participants who took imipramine in combination with zinc had significantly lower depression scores than the control group. Zinc promotes proper lipid and glucose metabolism as well as the regulation and formation of insulin. Multiple studies have shown that zinc supplementation lowers blood pressure, hyperglycemia and LDL cholesterol levels. Zinc suppresses glucose absorption and synthesis while increasing glucose metabolism and storage. It boosts the activity of key enzymes that help regulate glucose use and clearance from the bloodstream. Zinc also appears to be important for beta cell function in the pancreas, which improves insulin response and secretion. A study published in the Advanced Pharmaceutical Bulletin looked into the benefits of zinc supplementation in obese people. For 4 weeks, 60 obese participants between the ages of 18 and 45 were divided into 2 groups and given either 30 mg zinc or a placebo. The zinc group lost 3.7 pounds on average, and had a decrease in both waist circumference and BMI. Serum lipid profiles and fasting blood glucose levels did not significantly change, but triglycerides on the other hand fell by 15 points. The researchers hypothesized that zinc can control appetite by increasing leptin levels, as well as improving insulin sensitivity. A long-term study published in the journal Diabetes Research looked into whether zinc supplementation could help people with pre-diabetes. 55 participants were given 30 mg of zinc or a placebo for 6 months. Fasting blood glucose, serum zinc, serum insulin, HbA1c and lipid profiles were all measured. At the end of the trial, the zinc group had improved beta cell function, insulin sensitivity and overall better lipid markers. According to research, maintaining optimal zinc levels is critical for tissue regeneration and repair. Zinc is required by all proliferating cells, including inflammatory cells, epithelial cells, and fibroblasts. It is required for antibody production, lymphocyte function, and several mechanisms in the blood clotting process. It activates over 100 enzymes and is required for membrane stability and collagen maturation during multiple phases of wound healing. A study looked at the relationship between zinc levels and wound healing in hip replacement patients. The study lasted 15 months and included 80 patients ranging in age from 35 to 85 who had total hip replacement surgery. Following surgery, the researchers measured serum zinc levels, lymphocyte counts, and wound healing parameters. The study concluded that zinc deficiency was present in nearly half of hip fracture patients and was a strong predictor of poor wound healing. Zinc supplementation improves male sperm quality, density, and motility, as well as the chances of conception and pregnancy. It plays an important role in membrane stabilization and antioxidant activity, as well as preserving sperm by inhibiting DNA-degrading enzymes. A study published in BMC Urology sought to determine how zinc supplementation affected the quantitative and qualitative parameters of sperm in patients with impaired sperm motility. For 3 months, 37 men with low sperm motility were given 220 mg of zinc daily. Before and after the trial, sperm samples were collected and analyzed for semen volume, pH, sperm motility, normal sperm morphology and round cell. Zinc supplementation improved motility, ejaculation volume and sperm morphology to the point where they were comparable to the healthy control group. Zinc influences several reproductive processes in women, including egg formation and maturation, fertilization, epigenetic programming as well as embryonic, fetal and placental development. A study published in MPDI Nutrients investigated the relationship between selenium, copper and zinc concentrations in early pregnancy and fertility. The study made use of a cohort dataset with 5,628 participants from Australia, New Zealand, Ireland and the United Kingdom. There were no links discovered between copper and the length of time it took to become pregnant. However, the researchers found that reduced levels of selenium and zinc did cause women to have a harder time conceiving. The study concluded that supplementing before and during pregnancy increases the chances of a healthy and successful gestation. A comprehensive study published in MPDI Nutrients investigated the relationship between zinc intake and pregnancy risks. The study included 67 trials that measured parameters like infant birth weight, hypertensive disorders during pregnancy, spontaneous preterm birth and gestational diabetes. According to the findings, maternal zinc deficiency may be linked to low infant birth weight as well as the development of severe preeclampsia. According to research, zinc is required for optimal hormone production in both men and women. It may increase testosterone conversion in peripheral tissue and influence testosterone metabolism by decreasing clearance and increasing 5-alpha reductase activity. Overall, zinc will support optimal hormone production, but research indicates that it will not increase testosterone to supraphysiological levels. In most studies, higher zinc doses produced better results, however toxicity and copper depletion are of concern. A study published in the Journal of Nutrition looked at the relationship between zinc and testosterone levels in healthy men. For 6 months, 9 participants were given 30 mg of zinc gluconate and had their zinc and serum testosterone levels measured. The participants' testosterone levels increased from 239 to 461 nanograms per deciliter. At the end of the study, the researchers concluded that even a minor zinc deficiency will reduce hormone levels. Another study looked at the effect of zinc supplementation on sexual hormone levels in hemodialysis patients. The trial included 100 male patients on hemodialysis with end-stage renal disease. For 6 weeks they were given 250 mg of zinc sulfate daily and had their plasma levels of testosterone, follicle-stimulating hormone, luteinizing hormone, prolactin and zinc measured. Follicle-stimulating hormone and prolactin levels did not change over the course of the study, but serum levels of testosterone, luteinizing hormone and zinc increased significantly. On average, total testosterone levels increased from 447 to 847 nanograms per deciliter. Zinc supplementation also has an effect on testosterone levels and sexual performance in postmenopausal women. A total of 116 postmenopausal women were randomly assigned to one of two groups, zinc supplement or placebo. The researchers measured serum zinc, testosterone, hemoglobin and hematocrit of the subjects. At the end of the experiment, the zinc-treated group had significantly higher testosterone levels, as well as improved sexual desire, arousal, orgasms, pleasure and vaginal lubrication. Now let's talk about how to supplement zinc safely and effectively. According to research, zinc glycinate is the best form to supplement with. It improves zinc status more effectively than other chelated forms and has the added benefit of not affecting copper status. Zinc gluconate has also been shown not to cause copper deficiency even at doses exceeding 60 mg daily, making it a viable alternative if the glycinate form is unavailable. Adults should not consume more than 40 mg of zinc per day. An optimal daily dose is much closer to 25 mg from both diet and supplementation combined. And remember, unless zinc gives you an upset stomach, always take it without food for better absorption. If you have any questions, leave them in the comments below, and remember to like and subscribe for more content. Thank you for watching, and see you next time.